Despite the medical advances over the past 30 years, there's still plenty of concern about the AIDS virus. Each year brings thousands of new cases and many people who fail to get the necessary treatment. One response locally is the joint effort by groups working together as the Getting to Zero Coalition. Our guest is from one of those groups, the AIDS Action Committee of Massachusetts. We'd like to welcome its Executive Director, Sciortino. Thank you very much for being with us, Carl.
Thanks, Chris. Glad to be back.
First of all, talk about what does that mean? How do you get to zero?
Yeah, so we're talking about getting to zero new infections of HIV, which even 4 or 5 years ago would have seemed pie in the sky or aspirational in a way that was unachievable. The tools that we have now with providing treatment to people that have HIV so that they're virally suppressed, and by being virally suppressed, they're not transmissible to other people, they're not infectious to other people. That's a key part of getting to zero. And for people that are HIV negative and at high risk, getting them access to prevention options that didn't exist 5 years ago, specifically PrEP, pre-exposure prophylaxis. Those two things together mean we can actually end transmission of HIV in our community in a way that we couldn't have talked about realistically a few years ago.
Well, we're doing better maybe in the Boston area than many other places in the country, but we're not as good as some, such as San Francisco. So what are the missing pieces here?
Yeah, so San Francisco, as you may know, just launched their Getting to Zero Coalition a year and a half ago or so, and they really invested in creative ways of getting the prevention efforts out in the community. They scaled up their PrEP education and access campaigns, for example. In 1 year's time, they saw an 18% reduction in new infections, which we haven't seen that kind of reduction any place in the country for HIV since people were dying off in large numbers. It's really a testament to the kind of creative policy work you can do and the program work you can do. Here in this state, we just launched a PrEP public education campaign. So if you go on the subway today, you'll see ads on the red, orange, and blue lines and a lot of the bus stops letting people know that PrEP exists and referring people to talkprep.org, an informational website.
Explain how PrEP works exactly.
PrEP is a pill a day. It's an HIV treatment pill that's now being used for prevention purposes. So someone that's not living with HIV, that's uninfected, can take a pill a day, and if they're ever exposed to HIV through sex or drug use or whatever, the virus can't actually infect them because they already have the medication in their body. It's a prophylactic, it's a preventative pill. The best comparison people might think of as an analogy is birth control. You take a birth control pill every day in the event that you may get exposed to sperm and you don't want to have an unintended pregnancy. It's a preventative way of preventing unintended pregnancies. This is a pill that prevents HIV infection. It's FDA approved, it's covered by insurance. It works highly effectively. It's more effective than most vaccines are for other things that people think about. And yet most people that are at risk for HIV don't even know it exists yet. So
well, when you say people, I mean, in a sense, we're all at risk for it. But on the other hand, you want to target people. So who do you target with this?
So the CDC, the Centers for Disease Control, just came up with some metrics to say how likely is it that someone would come in contact with HIV in their sex life or in their daily life. So for example, gay men have a much higher rate of HIV in the community as a whole than heterosexuals do. So for a gay man living with HIV, the chances of coming in contact with HIV are higher just by having an active sex life. So for a gay man to be on PrEP, it means that if they were to have unprotected sex, the condom breaks, they forget to use it, things happen, and people make lots of choices that they may come to regret later. But the reality is that by having PrEP on board in their system, if they get exposed to HIV, they won't get infected. IV drug users are at high risk, of course, but we've been able to dramatically reduce the number of new infections of HIV in IV drug users by other prevention methods, specifically needle exchange, but that's still a population that would warrant looking at PrEP. But the CDC also recommends it for not just gay men, not just for heterosexuals, for anyone that is sexually active, who is having condomless sex with multiple partners, or if you're coming in contact with sex partners and getting STDs, for example. An STD is a symptom that you may have put yourself at risk for other STDs, including HIV, so PrEP is something you would want to consider as well.
Well, over the years, I've even heard concerns about people who consider themselves straight. They think their partner's straight. They're middle-aged. You know, not that many partners anymore. So, and yet I'm hearing even they should maybe get tested.
I think everyone should be tested who is sexually active adult. It should be a part of routine primary care at this point, although people can go to places like AIDS Action Committee and Fenway Health and others to get tested. But primary care should be the setting where everyone should be offered an HIV test as a matter of routine screening. The CDC is very clear on that. I think partly people also make assumptions, doctors make assumptions about, based on someone's age or marital status, whether they're at risk for HIV, but people get infected with HIV because they're not being open about their risk taking with their partners, with themselves in many cases, or just not honest with themselves about the risk they're taking. And I think the conversations around sexual risk are things that you need to be open to talking about with your doctor and ask the right questions and encourage your doctor to engage with you on those issues that might not otherwise be comfortable for a lot of people.
Well, sometimes when that conversation takes place, the patient starts treating the HIV virus, and there's no more transmission, we hope.
Right.
But that's not always the case. Does the doctor owe something to the partners who might be involved?
We do have clear privacy laws, so a doctor can't notify anyone else besides their own patient about an individual's health status or HIV status, HIPAA laws and other HIV privacy laws. That being said, I think one of the interesting things around PrEP is for someone that's living with HIV, if they have a partner that is uninfected, PrEP is something that partner may want to consider. It's recommended for the partners of people living with HIV. So infectious disease doctors working with HIV patients are also a part of the front line of prevention, not just by treating that patient, but by encouraging the patient to tell the partner about PrEP. It's still new enough that even the partners of people living with HIV don't know about PrEP yet.
Yeah. But you're also dealing with here, within the risk groups, you've got probably racial disparities.
Definitely.
So you need resources, you need outreach. So this isn't just going to happen at a drop of a hat.
Not a drop of a hat. The reality is, with the way the epidemic is going in this country, in this state in particular, we are seeing a slow decline of HIV infections in Massachusetts. We saw a 41% drop over a 10-year period. But we got stuck at this 700 new cases per year a few years ago, and we haven't cracked through that. With the tools that we have now, with PrEP in particular, we can get through that number and get down to 0 new infections. San Francisco just saw an 18% reduction in 1 year. In a place like San Francisco, where there's a lot of HIV in the community to begin with, to get to that level means that people with HIV are treated well, meaning they're successfully treated, and they have PrEP in the community. And there's no reason we can't actually be first in the country and getting to 0 new infections in Massachusetts.
Well, we should mention if people need any more information about this, either because they're dealing with this problem personally or if they just want to get involved, what's the best way to do that? People
can contact us at AIDS Action Committee, AAC.org. If they're interested specifically in PrEP, we just launched the ad campaign on the T, which links to talkprep.org, which is a great information. So if you're curious about PrEP, or you think your partner or your family or your friends or your children might be someone that should think about PrEP, talkprep.org is a good resource.
Thank you very much for being with us.
Thank you very much.
Sciortino from the AIDS Action Committee. In a moment, some medical advice on preventing and combating the flu.